Multiple system atrophy. It's a Parkinson plus disease. In here, there is Parkinsonism with orthostatic hypotension and impotence, incontinence, and other autonomic dysfunction is present. Multisystem atrophy, previously called Scheidegger syndrome, there is a triad called MAC. Motor abnormality like Parkinson feature, autonomic dysfunction like incontinence, orthostatic hypotension, erectile dysfunction, and cerebellar symptoms. Cerebellar symptoms like ataxia. So, multi-system go for MAC. Motor abnormality like Parkinson feature, autonomic dysfunction like incontinence, and cerebellar symptoms like ataxia. Anti-Parkinson drugs are generally ineffective in case of multi-system atrophy. Treatment is aimed as intravascular volume expansion like fludrocortisone, salt supplements, and alpha agonist. It is similar to NPH but no dementia or cognitive impairment. Progressive supranuclear palsy. In progressive supranuclear palsy, P for progressive, P for partial instability, there may be frontal lobe partial instability, there may be frontal lobe abnormality like apathy, disinhibition, impaired reasoning. There is vertical gaze palsy, especially downward gaze palsy. To complete external ophthalmoplegia, there may be rigor, bradykinesia, dysarthria. Diagnosis in MRI, there is hummingbird sign. In progressive supranuclear palsy, there is hummingbird sign showing atrophy of the midbrain. Atrophy of the midbrain structure with a relatively intact pons region. So, what is the most likely diagnosis in elderly female who presents with downward gaze, pulse, postural instability, bradykinesia, and upper extremity rigidity? Think about postural, progressive supranuclear palsy. MRI shows atrophy of the midbrain structure with intact pons. MRI shows atrophy of the midbrain structure and intact pons associated with tau protein neurofibrillary tangle in the basal ganglia, cortex, and the brainstem. Basal ganglia, cortex, and the brainstem. And the other Parkinson plus dementia of the Lewy body, in here antipsychotic works better, like second generation antipsychotic quetiapine.